Lauren. I'm going to be your nurse today. Can you tell me your name and date of birth, please?
Haley Rolling 2899.
Okay, this is the correct patient. So we're going to be doing an oxygenation exam today. If you have any questions or feel uncomfortable at any point throughout the exam, feel free to stop me. So the patient understands the procedure. Do you need to empty your bladder?
No.
Okay, so here's a gown. Go ahead and put it on. It ties in the back. Are you comfortable in this room with regards to warmth and privacy?
Yes.
Okay, so the patient is prepared for the procedure and she's comfortable in the environment in regards to warmth and privacy. So first I'm going to take your oxygen saturation. This will turn on. There we go. Okay, so I just need one of your fingers. Okay, oxygen saturation is 98. I'm going to look at your lips and your fingernails. So the lips are pink, there's no blueness noted, and the fingernails are at 160 degrees, so there's no clubbing. And I'm going to feel your radial pulse. Okay, so respiration rate was 12. Now I'm going to ask you a few questions. So have you had any chronic respiratory problems or any issues with breathing or your lungs?
No.
Have you felt any pain or shortness of breath when you breathe?
No.
Okay. Have you had a cough?
No.
And have you ever been or are you a smoker?
No.
Okay, so if I noted any abnormal findings, I would assess using Old Cart's ice. So now I'm going to move around to the back and inspect your breathing from back here. The patient is sitting upright. There's no use of the accessory muscles with her breathing. Her skin tone is appropriate for her ethnicity and there are no abnormal lesions. The thorax and scapula and muscular development is equal bilaterally, and the spine is straight, and the ribs are at a 45-degree angle. So now I'm going to listen to you breathe. Just go ahead and breathe normally for me. Okay, so lung sounds are equal and clear bilaterally. Bronchovesicular sounds were heard at the top and vesicular sounds were heard at the bottom. There were no adventitious breath sounds noted. So now I'm going to inspect the front. Again, the thorax is symmetrical on both sides. The ribs are symmetrical. There is a 90-degree costal angle. The AP to lateral diameter is a ratio of 1 to 2. And now I'm going to listen to your breath sounds from the front. Do you ever have shortness of breath or pain when breathing? Have you ever smoked or do you currently smoke? If the patient reports symptoms and have assessed using Old Cart's ice, that's non-exam. Patient is upright and relaxed. Breathing is non-labored, in, quiet, and skin is pink and normal flatness, and there's no skin lesions noted. There's also no retraction. Now I'm going to take your pulse. Alright, so again, the lung sounds are equal and clear bilaterally. Bronchovesicular sounds were heard at top and vesicular sounds were heard at the bottom, and there were no adventitious breath sounds. so now I'm going to palpate your back. Let me know if you feel any pain or tenderness. Do you feel any pain or tenderness?
No.
No? Okay, and go ahead and take a deep breath for me. Okay, so no pain or tenderness was noted, and there was equal expansion bilaterally with respiration. And then now I'm going to assess for vocal fremitus. So when I touch your back, go ahead and just say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so vocal fremitus was equal bilaterally. Now I'm going to feel the front, so I'm just going to feel your trachea first. Okay, so the trachea is midline and slightly movable. Now I'm going to feel your clavicles. Okay, so the clavicles are symmetrical, they're stable, and they have developed musculature around them. And now I'm going to feel your ribs. Do you feel any pain or tenderness? No? Okay, so the ribs are, again, symmetrical, no pain or tenderness was noted. And now I'm going to assess for vocal fremitus on the front. So repeat 1, 2, 3 when I touch you.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, so vocal fremitus was again equal bilaterally. And that's the end.